Hello everyone, this is Dr. Ridhima Gupta. I'm American Board Certified Obstetrician and Gynecologist. Today I'm talking about ACOG Committee Opinion on HPV vaccination, which was published recently in August 2020. HPV is the most common sexually transmitted disease worldwide. It is associated with genital warts, anogenital, and oropharyngeal cancers. More than 150 HPV genotypes are known. 90% of cases of genital warts are caused by HPV genotype 6 and 11. 13 genotypes have been shown to cause cervical cancer. Each year, more than 13,000 women are diagnosed with cervical cancer, and nearly 4,000 women die from the disease in the United States. HPV vaccine is a recombinant vaccine that doesn't contain live virus or viral genetic material. Three types of HPV vaccine are approved by FDA, including bivalent, quadrivalent, and nine-valent vaccine. Bivalent and quadrivalent vaccine are approved for women and men aged 9 to 26 years. Nine-valent vaccine is approved for women and men aged 9 to 45 years. Currently, nine-valent vaccine is the only HPV vaccine available in the United States. Regarding timing and dosage, if the first dose of HPV vaccine is given before 15 years of age, only two doses are recommended 6 months apart. 6-month interval between these two doses is critical for ensuring adequate immune titers. If the first dose is given after the age of 15 years, 3 doses are recommended at 0, 1 to 2, and 6-month interval. Vaccines are most effective when given before exposure and infection with HPV. Target age group for HPV vaccination is age 11 to 12 years. Unvaccinated women aged 26 years and younger should receive the HPV vaccine regardless of sexual activity, prior exposure to HPV, or sexual orientation. Testing for HPV DNA is not recommended before vaccination. HPV positive women can also receive HPV vaccine. HPV vaccine in women of age 27 to 45 years is based on shared decision making. The vaccination is beneficial for younger women, women who are not committed in monogamous relationships, and the women who are recently diagnosed with sexually transmitted infections. The vaccine is not recommended in pregnant women. Routine pregnancy testing is not recommended before vaccination. If the vaccine is administered unintentionally to a pregnant woman, the limited safety data available is reassuring. Vaccine should be given to breastfeeding women aged 26 years and younger who have not previously been vaccinated. In immunosuppressed population, vaccination is not a contraindication. However, immune response is less robust. 3-dose schedule is recommended for immunocompromised patients even if younger than 15 years. Safety data for all 3 HPV vaccine is reassuring. The vaccine is contraindicated in patients with severe allergy to yeast or prior HPV vaccine. Individuals with moderate or severe febrile illness should wait until the illness improves before receiving the vaccine. Syncope and injection site reactions are common after the vaccine, but serious adverse events are rare. Nine-valent HPV vaccine had a higher rate of injection site swelling and erythema as compared to quadrivalent vaccine. Patients should be observed at least for 15 minutes after vaccination. The HPV vaccines are amongst the most effective vaccines available worldwide. HPV vaccine has significantly reduced the incidence of anogenital cancer and genital warts. The vaccination has also decreased the incidence of oropharyngeal cancer. Therefore, to conclude, HPV vaccination is recommended for all boys and girls at the age of 11 to 12 years. The vaccination is also recommended ages 13 to 26 years regardless of sexual activity, prior exposure to HPV, or sexual orientation if they were not vaccinated in the target age of 11 to 12 years. Vaccination is recommended for women aged 26 years or even if the patient is tested for HPV DNA and the results are positive. Testing for HPV DNA is not recommended before vaccination. Vaccination is not recommended during pregnancy. HPV vaccine should be given to breastfeeding women aged 26 years and younger who have not been previously vaccinated. With a history of sexual abuse or assault, the HPV vaccine should be given as early as possible, starting at the age of 9 years. HPV vaccine in the women aged 27 to 45 years is administered based on shared decision making. ACOG does not recommend that individuals who have received quadrivalent vaccine be revaccinated with a 9-valent vaccine. Thank you for listening to my presentation.